Okay. And we are live. We are live on LinkedIn. We are live on Facebook. Okay. We are not going to talk about that. We are going to start the podcast and we will see as people are joining. I'm just watching on another device just to see where things are up to. We're going to jump right in here. And editor, cut this out. We'll start from here. Okay. Welcome to another live recording of the Nursing Home Podcast, the only podcast that you need to know what's really going on in the nursing home industry. This is such a complex industry. This is an industry which is slaughtered and beaten and dragged through the mud in the media and coffee shops and everywhere in social media because of the misunderstanding of what's going on in the facilities. The goal of the show is to dispel the murkiness and the blurriness and to really help operators understand how to best manage their facilities while at the same time educating the bystanders. In today's episode of the Nursing Home Podcast, I'm really happy to introduce the CEO and founder of a very innovative company called Carefeed, which we will talk about a little bit later in the show today. Terry Wall. Terry, welcome to the Nursing Home Podcast.
Thank you, Shmuel. Terry Wall, founder of Carefeed. Really honored to be here. Thanks for having me. Congrats on the podcast, too. It's great.
Thank you so much. I appreciate that. I'm actually curious how you discovered the podcast. I know you guys reached out directly from it.
Well, I'm a big believer in being productive. So podcasts are a great way to learn, whether you're commuting or running or whatever. So big believer in podcasts, and
Awesome.
I just love how you're straight to the point. It's cut through the murkiness, like you mentioned, and just tell it how it really is. And so it's great. So we've been a follower.
Awesome. I appreciate it. I appreciate your support. So our audience doesn't know who you are yet, and I'm getting to know who you are right now. If you don't mind sharing with us the brief professional background of what brought you from your career to what you're doing today.
Yeah, perfect. My whole career has really been transforming print to digital. So last 10 years, prior to Carefeed, I worked for the leading patient engagement, kind of patient technology, patient and really provider facing technology. And so I just saw all the cool products that, the ambulatory space was getting, physician offices. For example, instead of those like anatomical posters, now they're iPads, 3D anatomicals versus the poster. Saw the cool products in the subacute space, hospitals. But I felt like this care setting of all the care settings, there were some antiquated processes and felt like we could help.
Awesome. So first of all, I just put a little shout out to those who are watching us live on Facebook and those who are watching us live on LinkedIn. I don't know why my son thinks it's LinkedIn and not LinkedIn, but that's a fact that, that we have. But anyway, all that aside, so you're the guy who is innovating a very a space that's not known to be so innovative. I know one of my earlier projects as administrator in training was going to EHR to get the electronic health records, and the pushback is tremendous. And I don't know exactly why it is that people feel that we need to continue working with antiquated tools, even though technology has exploded and continues to explode every single day. But kudos to you that you're doing what you're doing in this industry, and that is really amazing. So let's talk about the problem. The problem, on a high level, and I want to hear from you as well. But
Yeah.
the overall problem that we're addressing today in this episode is communication. And we all know that communication is everything, and many challenges in all areas, professionally, personally, we can trace to a breakdown in communication. And if I knew what you knew when I needed to know it, and you knew what I knew when you needed to know it, lots of times we could have avoided unpleasant situations, and problems, challenges could be avoided. little soapbox. But now, all that aside, within a nursing home, there are so many different parties. So tell me how you've seen this problem, where you've seen the problem the most, and what has been the impetus for you to get involved on this level.
Well, I started Carefeed before COVID, and I think that's what really exasperated the problem of communication was COVID. As you know, COVID adversely affected or disproportionately affected senior communities more than obviously they're the most vulnerable population, obviously.
Hmm.
The spotlight and attention was all on the senior communities as staff had to navigate a barrage of ever changing, confusing, conflicting regulations, updates, guidelines from all these local, state, federal entities, and communicating without every piece of the puzzle, obviously difficult. So the communicating with residents, communicating with families, communicating with staff, communicating with referral sources, and that timely of information and being transparent when you don't have all the information, not easy to do. And yeah, sure, all these senior communities had emergency action plans for whether it was like a disaster or something like that, but nobody was prepared for the scale and size and scope. I mean, we're approaching 2 years of this pandemic, and it's not it's not easy. The staff at these senior communities, it's not easy. I mean, in fact, just recently, like within the last month, a COO told me they looked at their phone bill and 2,000 of the 3,000 calls were unanswered. So I think it was really the COVID that when the families couldn't visit, that's when it was like, hey, we need communication. That's where the problem was really exasperated.
Okay. So first of all, thank you for that very full and complete answer. And your point is so true. When we talk about disaster response, emergency response, anything that requires a timely response, and specifically, obviously, in nursing homes, um, there's a binder, big red binder on all the nurses'
Mm-hmm.
stations that says emergency preparedness, and
Yep.
you can flip to the fire page, you can flip to the active shooter page, you can flip to any other page.
Yep.
Um, is that how practical is that in real time? It's great tool for education if it's used,
Yeah.
and some people do a great job at using them for education. I actually once did an active shooter training in the building where I was the administrator, and our book said code black, I think, or something like that. And code black means, guy with a gun in the building.
Yeah.
So when the local police department was looking through it, and they were actually in the building, doing all sorts of simulations, um, they said, no, don't do that. He said, when there's a guy with a gun in the building, you just announce, guy with a gun in the building,
Yeah.
duck,
Yeah.
run, do your
Exactly.
thing. He said, don't code bully. It's a secret from the guy.
Right.
When Department of Public Health is in the building, people have codes, Dr. Goldstein line 1, and everybody knows DPH is here. That can work. But the guy with a gun in the building, he doesn't care, if everybody knows. But the point is, um, lots of the tools, and it's not specific to emergency preparedness, but lots of the tools are done in a very antiquated way, which they were the best way that things could be done before technology has evolved to where it is today.
Precisely.
um, and many times, because it works, it ain't broke, and like you said, there's so many other pressing needs, so we kind of leave things the way that they are and don't innovate to the level that we should be innovating. So that's
Well,
why we
yeah,
need.
you make a great point because first off, how you communicate is amazing. Trust me, because we have almost 1 million messages that have been sent through Carefeed, and I see some messages good, some messages like, "Ooh, I don't know if I'd say it like that." So the way how you communicate it to that, police officer's point is a good point. And then, the other thing I would say is what also exasperated this is a lot of times they'd even have the contact information. I think that was really big during COVID. They're like, holy cow, in the EMR or EHR, we don't even have the family's contact email or, and staff. I mean, this is an on the go workforce. They're not sitting at laptops. So they don't have company emails like other industries. So having all the employees' contact information, having all the POAs, those family members contacts. That was alarming. I think people realize like, wow, we don't even have all these to even send them. So if we have a message we want to send, we don't even have that. So I think that was a big piece of it too.
Yeah, a couple things come to mind, but one thing I'll just share briefly, an incident which I witnessed actually firsthand of somebody who was coding, meaning they needed CPR, and it was a question of what their status was. Is this someone who wants that? Are they a DNR or not? Do not resuscitate. And when in doubt, they had to do what they had to do. But it was besides for the actual medical crisis, the additional crisis was, who is the healthcare proxy? How do we get through to that person? What is their phone number? Like this type of critical data. It wasn't just letting them know when the holiday party is going to be and they should drop off their gifts. This is literally life or death,
Yeah.
and that can be a very serious issue. But I think drill down a little bit, there's really three types of communication that are happening within a nursing home. You're welcome to disagree. I'm just thinking now. Number one is this communication between the facility and the families, right? And letting the families know there's a change in condition. And, usually if you're lucky, you have a unit secretary or a nurse if they remember to call. And that itself is a big deal. A family member gets sent out to the hospital and you don't let the person know who you were supposed to let know, or sometimes even worse, you let the wrong person know and they weren't supposed to know. That's a problem. There's also communication between the facility and and the staff, which is usually that information. If it's done correctly, then HR person has that. Not just different types of communication; they're also held and managed completely differently, and that's why it's very fragmented and segregated. So the HR person, the business office manager, who's there only typically during business hours, is the one who has all the employee information and relationships and phone numbers, and knows that Jenna on Tuesdays is you call her at the other number and all those other things if it's documented anywhere. But that's usually the person who would know in the basement or upstairs on the third floor in the back room or wherever it is, right? That's typically that information. The information about the residents, yeah, a lot of it could be in point of care or whatever EHR you're using. Then there's also the information, the family's information. I'm sorry, the external vendors that you're working with, whether it's the hospitals, whether it's other community resources, and those things also can be in either system. But many times they don't talk to each other, and I think that even with the tools that we do have, that's still something which can be a problem. And add to that a crisis. I hate keeping using COVID. But
Yeah.
let's talk about a fire in the building, and you have to let everybody know that they're okay, or unfortunately, you have to let them know that some people are not okay, or let them know that we evacuated the building, or we had or a simple thing, we moved someone from one room to another room because of this reason. Simple things like that, to be able to have that done, in a better way. So, first of all, does that make sense to you? Like, are there other
Absolutely.
areas?
Yeah, no, I think you're absolutely right. Family, we always say, residents, family, staff, and referral sources. Yeah, so those four, yeah, I think you got it, hit it on the head there. Yep.
Residents, families, staff, and referral sources. Okay, yeah. So fine. Yeah, that's pretty much the same thing. So now, what are some tools or some systems that a nursing home can implement today, which
Yeah.
can help streamline some of this communication? Like, I'm sure before you created your own solution, you did your market research, or maybe you talked to clients. Maybe you can, what are some things that someone can implement today? I want to come out of this podcast on my lunch break, maybe still, if you
Yeah.
still have that. Yeah,
Take take Carefeed out of it. I'll tell you, what I find is, a lot of the communities are calling. They're just manually like, you call these 10, you call these 10, you call these 10, or hey, I'm calling, and they call the families. I have communities that mail letters. They're mailing letters, weekly updates, or even certified mailers to make sure to ensure receipt that they received it. So the certified mailer is the recipient has to sign it, and it's like $7. I'm like, oh my gosh, you're doing certified mailings, faxing. I mean, believe it or not, people are still faxing. I get that. Hey, can you fax that to me? It's like, wow.
What is a fax?
Exactly. And then there's the school kids, the robocallers. The people can implement that, because I don't think the need for mass communication was as big. So there's like the robocallers. They're the updating your Facebook page, updating your website. Just providing information to all the audiences that you mentioned there. So those are some of the things you could do. I mean, there's WhatsApp. There's different things you can, set up, to communicate with employees and things like that. It's not easy because, like you mentioned, it's fragmented. Some employees are on the shift, app. Some employees aren't. Some audiences use this EHR. This hospital uses this communication platform. These referral sources are, churches and home health companies and hospice companies. They do it differently than a discharge from a hospital and things like that. So it's fragmented. It's not easy with everything else the staff has going on. As the staffing is a real issue. So anything that's going to make their lives easier is like top priority, because they do not have it easy right now. You mentioned they're under, nursing communities are under a lot of scrutiny. I heard something recently that they said they're the most regulated. I think it's like nuclear power plants, and then long-term care kind of nursing
I've
community.
never verified that, but this is what they
Yeah,
say.
that's what I've heard. I don't know if that's verified. I'm like, wow.
Definitely feels that way.
So yeah, and then just with the staff, everything they've been through. I mean, I was just at a community recently. We're based in Ohio, and this was in northern Ohio. I was at their community, and like Cedar Point, everybody knows Cedar Point. It's like roller coasters and things like that. I mean, they're offering $1,000 sign-on bonuses, $20 an hour to clean rooms at Cedar Point, and this is what the staff's competing with at a senior community right down the street. It's these staff putting their literally lives at risk, right? Fear of the unknown with this invisible enemy that they're dealing with. To go do, there's a lot of people leaving, which is so any tools you could provide to make their lives easier, I think, is absolutely critical right now.
Right. I mean, this is a obvious opportunity for a shameless plug for Quality Recruit, which I'm going to take the opportunity to do this, which is the recruitment company which I manage.
What's the name of Quality Recruit? Got it.
You got it, qualityrecruit.com. But if people need help with this very problem, this is exactly what we do. And like I tell everybody, we don't have the magic bullet to create people that don't exist, but we help and support the facility's recruitment efforts so they can be as successful as they can be.
Yep.
Moving right along.
Yeah, so census is down, obviously. And then so obviously expenses have to go down if the census is down, and it just puts them in a difficult predicament. So any tools to make it easier. But then I feel like at the same time, you have these family expectations that have evolved and grown because of everything that's been going on. And, and even employee expectations are higher, now. I mean, as could see all over the media today, right? So, at the same time, we have, staffing shortages or that kind of workplace a difficulty you got to have, like raising expectations. So to make it easier to communicate is just it's crucial to the that trust and that transparency in your brand to be able to be marketable and get the referrals and things like that. Really, really important.
Amazing. No, this is definitely very true. And like you said, there certainly are many tools out there. WhatsApp can be very, very helpful for internal communications, and for those who are busy with that app, you probably have a million different groups already with different parts of your life. You have the option of separating business WhatsApp and personal WhatsApp with two different apps, not just different groups, so that can help a little bit. That's also good for timely communication, even simple texting groups, and even if old-fashioned email groups are all effective ways of communicating. And separately, they can each help resolve the issue, meaning that they can help. Um, you could have an email group to the families. You can have a Facebook group. The main thing is not the tool. So I hope we'll talk about a different tool in a minute. But yeah, the truth is, it applies to everything and any tool that you use. And you've had the opportunity. If you've had the opportunity to implement tools in your business, you'll know that it's true. It's true that there are differences in the tools that you use, and we'll get to that in a minute. But at the end of the day, whatever tool you choose, you've got to go all in with that tool, use it the way it was designed to be used, and let everybody know that this is the tool. Like, for example, when we were going to electronic health records, or even not, even before that, it's just harder to cheat these days. If it's not documented, it didn't happen, right? And if it's not documented here in this way, it's in a very precise, system, so it didn't happen. So the same thing, if our communication internally is through WhatsApp, so if you didn't put it there, then it didn't happen. If you did put it there, then there's a responsibility for whoever needs to know about it. That this is what happened.
And with these changing, ever changing regulations, that's what makes it cumbersome to the staff when they have to duplicate processes. Like, okay, so we called everybody, now we
Hmm.
have to chart it in the EHR, so it's like duplicative and cumbersome, and back to just need to make the staff's lives easier. That is the most important thing right now.
Well, so let's talk about Carefeed.
Okay.
So you created Carefeed. Tell us a little bit of what it does and how it further helps solve this problem.
Yeah, so we have four core solutions: communication, obviously. So we have templates for clinical and non clinical communications. So we can seamlessly send broadcast or secure one on one messages. We can do text, email, voicemail. Um, we can automate communications. So, based on ADT triggers and, in your EHR, all our communications can be automatically translated, by the way, into like 109 languages, and they're automatically charted. So if you do send that message to families, it automatically will chart in, PCC, matrix care, etc. But then you could automate some of these messages like, okay, someone's admitted, here's the essential next steps, or here's the facts about your stay and what to bring and things like that. Um, so automation and the kind of the communication, we do calendars, so automating communication with care conference scheduling, visitation, offsite doctor's appointment, all different types of things like that. Communicating with staff, so of course digitizing in service is big, sending videos, and these communities are bringing in employees on their off days to have them in a room to watch a Zoom, sign a piece of paper that they watched this, video, or some policy, updated policy. We could text that out. They sign and have a digital record of the consent and things like that. Resident admission agreement, hard to believe, but people are still doing paper admission agreements. I get it. It's kind of the process you're used to, but having to meet people outside because they can't come in, signing documents on the hood, but really it's about the data today. Well,
Hmm.
hey, what's my payer mix? What's how many people accepted arbitration or agreed to arbitration, things like that. It's about the data really on those admission agreements. So all different types of solutions like that. We like to say we are the central place for seamless communication with residents, family, and staff. It's kind of our tagline.
Okay, that was my next question. Is if you had to put it into one sentence, what is Carefeed? So, first of all, thanks for sponsoring today's podcast. We definitely appreciate you sharing your knowledge and expertise with us today. But if you want to understand what it is, so you said it's a seamless communication between What is it? Resident staff?
Yeah, your central place for seamless communication and engagement with residents, family, and staff.
So basically, what it seems like to me is that you're looking through all the broken uh, communication pieces that are part of the daily or whatever, part of the operations of a nursing home, and saying where can we come in and fix this? And as opposed to being, there are companies that just do one piece, they just do two pieces. They're like, okay, let's get rid of paper. In my administrative days, I would tell people if you gave me a paper, it didn't happen. Because what would happen? I'm walking around the building. I'm in one unit. Someone hands me something to sign, and the next place, someone gives me an invoice. And by the time I get back to my office, the invoice is in the other unit, and the other thing is on the floor with whatever. And I have nothing. I'm like, everything has to be. If you want it to go to me, it has to be emailed to me. Otherwise, I never got it because for me personally that that doesn't work. But basically, it looks like what you're doing is you have this big machine, this digital machine that it's almost like a vacuum cleaner that's sucking up all the broken process, the broken paper, fragmented processes within the nursing home, and just like Carefeed, put it in, put it in, put it in. And as you're going through,
Yeah,
by the time you're done vacuuming that facility, every process has been worked out in a way that it's digital, it's clear, everybody knows where it is, the communication is seamless, like you said. um, Documentation is shared in the way that needs to be shared. And like you said, it's absurd that we make a CNA come in on their off day to an empty conference room to watch a video to sign a paper that hopefully ends up in the right binder, and that you could find it when DPH is in asking if they were ever in service. Hopefully you can find that piece of paper there. um, the good, it makes good people good, and there's no more sticking in a paper when DPH is there either. This is why
yeah,
people are scared about electronic health records. It used to be that you can pull out a paper or stick in a paper or modify something. There's none of that, which is fine, which just means that people are not scared of their Department of Public Health inspection when they know that they're doing the right thing every day. It's a thing that people say, but some facilities you can just feel it. Yeah, all right, they're here. They're gonna watch what we do. We know what we do. Um,
yeah. To
and
your point is that we like to say the kind of like that whole central place for seamless communication engagement. Essentially, what we do is we digitize and automate a lot of the antiquated processes. Think paper admission agreements, printed welcome packet folders, safety notifications, and then we seamlessly distribute that via text, email, or voicemail. So I know it sounds like a vacuum. It's because we're in a building downtown, and the building next door is getting a new roof. So I don't know if we don't normally sound like a vacuum, but yeah, I want to be those operational efficiencies that we can create. It's simple. It's a SaaS model, so it's a simple monthly fee. I mean, very inexpensive, and it just makes staff lives easier, decrease costs, and actually can help boost the census. We have some solutions that could even help boost the census as well. Whether
let,
that, yeah.
let's talk about those. What do you have that specifically for census related? Then I want to
So
talk about staffing related, but let's start with
yeah,
census.
exactly. No, we don't do any staffing. So goodness, so we're a core queue vendor for like surveys and questionnaires. So getting that resident, we could automate the resident family satisfaction surveys. So really be able to get real time feedback to influence the outcome. But then we could also do boost and steer positive reviews. So if someone's discharged, it could be automatically get a positive review. If they get 1, 2, or 3 stars, feedback just goes to the community. But if they get 4 or 5 stars, we could take that to Yelp. We can take that to Facebook,
Google.
et cetera. Yeah, and Google and that. So obviously, the more recent, positive reviews, really the ability to steer it. It's people are looking at that these today.
Do you do checking kiosks?
We do not do check-in kiosks. We do have a visitation. Visitation. Families can set their visit. They can be pre-screened before they get there and things like that. But we don't do the hardware.
Mm-hmm. Mm-hmm. So you're sticking to the SaaS model. Okay, very interesting. As far as staffing, recruitment, retention, is there anything yet built into Carefeed that deals with that? If not, then we have to have a conversation.
Yeah, just the really thing is digitizing the in service with the electronic consents and building that library to help. Outside of that, no, nothing for recruitment.
Okay, so I don't even mean recruitment. There's recruitment, but there's also retention. Um, for recruitment, it can here's some free some free feedback. It might be worth the price that you pay for it, but um, for recruitment, just if is there a way to automatically post things on social media through through Carefeed? Like for example,
We're close. We're close on that. Yeah. So if they send a message out to the families, it could also simultaneously,
put on the
post
Facebook page
it. Yeah.
and things like that. Or if someone takes a picture on their phone, they can use Carefeed to push it out to all the social channels.
Oh, yeah.
Again, with maybe you may want to have a built-in approval process for that because
Yep.
there's liability involved there as well. So there's a lot of things that can be done with that too, and that could be for census development, and it could also be for recruitment, but specifically for attention, checking in with staff members, giving them an opportunity to have communication. Like we said in the beginning, everything is communication. Many
Yep.
times, and we're basically using technology, not just the vacuum cleaner, like we said before, but also using it um, to replace some redundant human processes, especially in a nursing home where we don't have that luxury anymore because it was just working with such a tight staff. So, for example, it would be wonderful if HR could sit down with all the new staff members, with all the nurses, with all the new CNAs, the first week and the second week, and maybe once a week for a month, and then every month, and then every quarter, and to really get feedback and to share information and to give them resources and all that. What about automating some of that?
You know what? You're dead on. We actually do that. We can do
Okay.
onboarding employees, so signing the W-9s, I-9s, W-4s, all that. And then we could automate things like, okay, on the 90th day of their hire, let's send them this. It could be could be a survey, could be a video to watch and things like that. So we have some of that, but no, I like kind of where you're going with that as well, though. There's some definitely some more we could do there. It's important. I mean, it's different from other companies. They all, the one thing in common, they all have a phone, and that's where
Right.
we could send it right to the mobile phone.
Right. I mean, I'll just tell you just from our experience as a recruitment company, sometimes the recruitment problem could be solved, and then the retention problem exacerbates the recruitment problem. So they come, but they're leaving after 2 weeks. The reason why they're leaving after 2 weeks is because they still don't have a parking spot, and they still don't know where to keep their bag, and the paycheck was late because information was never gotten to the right person, and stupid things that
Simple
technology could have
feedback.
solved.
Yeah.
Boiling down to communication. I don't know if this is the right forum. I'll throw it out there, and you'll tell me if you're comfortable talking about it. Is there a standard monthly package that you can talk about, or is this a conversation? Check out the website, and we'll talk to you.
Yeah, check out the website, but it's based on the size of the community. Yeah, it's
Got it.
based on the
Got
size
it.
of the community. So yeah, it's a per bed per month kind of format. So yeah, go to carefeed.com. There's a schedule a demo up on the right hand side, and we work with communities across the country. So
Awesome.
we're been in a full sprint. Like I said, this started before COVID, right at the beginning of COVID. I think it was January 1. And gosh, it's been a full sprint, and we really just want to make staff administrators and their staff's lives easier. I mean, that really is our goal is to kind of digitize those antiquated processes, automate some of the redundancies and duplicative work, and just from what we have found, we've decreased costs in a lot of cases, so people end up
Awesome.
spending less. So really appreciate the opportunity to be on the show. And anything else for me?
Yeah, I'm not throwing you off yet, but very soon. Uh, the one last point has been talking about, cost savings. There's a lot of, I'm sure you run into this, but a lot of operators probably have maybe 3 or 4 different systems that are each doing a piece of what you're doing, but you're
Sure.
being like the one system. I know there are systems for automating, phone and email and texting messaging to go out. I know of another, I'm thinking of specific systems, and they're all great at what they do. There's another system that all they do is the admission paperwork, another one just for onboarding, another one just for family communication. I think literally they're They really, and sometimes you may have multiple,
Exactly.
multiple systems arrays. So if this is one system that is kind of the end all be all, and it does everything that you're saying, it really sounds like a very interesting opportunity. And I would definitely encourage operators to go check out carefeed.com and schedule a demo with your team. Terry, before we let you go, first of all, thank you for being an excellent guest. Thank you for sharing everything uh, that you've shared. I
Thank you,
see
Shmuel.
that.
Appreciate
uh,
it. Appreciate you having us.
Yes. I'm going to share one comment over here from Shmuel Krisher. First of all, great name. Um, and it definitely is huge. This is definitely it definitely can be a game changer. But moving right along. Um, any final words that you want to leave with our listeners before we let you go?
We have had a lot of big healthcare organizations, 50, 60 communities do exactly what you just mentioned. Consolidate. They employees have all these different usernames and passwords to get into all
Mm-hmm.
these different places, and you can consolidate and just make it easier for the staff from like training and onboarding. And we have a client success team that does all the training, so just helping from that regard. But no, we'd be honored to assist with anyone. We feel like we have a lot of raving fans out there where we are integrated with a lot of EHRs. So, Point Click Care, Matrix Care, Epic, etc. And yeah, it's like save your team time. I feel like as owner operators and management groups, doing that is really important right now, and that's what we're trying to do is just make administrators and their staff's lives easier.
Awesome, awesome. I'm checking out the website right now. It definitely looks beautiful. Thank you so much for coming on the show, Terry. We really appreciate you sharing of your knowledge. And again, if anyone's interested in this, you go to carefeed.com. And like we said earlier, um, even before you're ready to make that step, there's so many. Some people may not be a good prospect yet. These are people. There's still the paper people, and if you start implementing, I mean, I think this is the takeaway. Start implementing processes to streamline, the way that you're doing all the different systems within the nursing home facility, and the way that makes sense for you. So thank you so much, Jared, for coming on the Nursing Home Podcast, and we look forward to staying in touch. I really think you guys are doing some amazing stuff.
Thank you. Right back at you, Shmuel. Thanks so much.